The way that I see it really comes down to the point that I mentioned before about organization of data, right? You can collect all this information, and now you have to parse it out and make it granular so you know what to do with it. And um, for us, we're the brick and mortar medicine is never going to go away, right? I mean, to your point of wanting that personal touch, to wanting things, obvious things like procedures and things like that, like it's in our lifetime, I would say my lifetime, it's probably never going to go away, and therefore there's always going to be a need for hospitals, there's always going to be a need for outpatient clinics and things like that, because there are some certain things you just can't do over telemedicine, not necessarily just at Cerebral, but in other, I guess, companies, other fields that they specialize in. And so one of my specialties, as far as being able to determine what you can do and what you can't do, really comes down to the severity of the case, right? So for simple kinds of things, you have mild depression, mild anxiety, a little bit of insomnia here and there, or even moderate, like that's totally manageable over telemedicine. And even when you talk about medical conditions, like if you have if you're a sexually active female with a urinary tract infection and it's otherwise pretty routine for you, you can more often than not get treated without actually having to be seen in person. But there are a number of other cases where you do need to see someone in person because they'll need to actually lay their hands on you, like actually do a physical exam, take some labs, do a little bit more in-depth interviewing. And those are the cases where, at least for right now, telemedicine should not be engaging in that, right? Because you're performing more intensive, I guess, therapies and engaging in more intensive, I guess, treatments over great distances, and it's just not safe for the patient. And so for those who need more intensive care, should be seen by someone in person, and I firmly believe that. And the organizations that I've worked, that I've set up, like we made that as like principle to say, like, look, if this is too complicated, should not be able to treat it. And that sounds it doesn't sound like holistic or all-encompassing care, but this is something that we have in our current healthcare system, right? So if you go into an urgent care center and you need a refill of some blood pressure medication, they'll be like, sure, fine, we'll refill it for you. But if you come in with like a severed arm, or you're actively having a heart attack, they're not going to treat you. They're going to say, you know what, you probably need to go to the emergency room, and then they'll arrange for means for you to go there. And so just because you have a new patient facing front, a new medium, a new vertical, or what have you, for whatever service that you're talking about, like, it's not going to get rid of the old system entirely. And so how this is relative to an organization of data is really just the triaging system that we spoke about before, where if you can take care of very simple things over telemedicine, then great, do that, and then you'll avoid complications down the line. But for those complications that present themselves to your storefront, you need to push that aside. So I think for someone like your grandmother, probably needs to talk to someone in person, right? Not only is she used to that, but you can imagine that there might be some inherent complexities in your care that would just make like a 30-minute visit kind of undoable, and that's kind of saying a lot, because a lot of times when you go see the doctor, they have 15 minutes to see you, and so there are certain limitations, and we're very well aware of that, and a lot of companies are very respectful of that as well, to say, you know what, this just cannot work right now. As it evolves, as it becomes more adopted, and certainly I think you can expand the level of service and level of access that you can provide to people. But that needs to be something that's done on almost like a case by case or edge case kind of basis, where you can build a model that's both safe, both for the patient and for the provider as well.